This is Dr. David W. Kim. Tonight's rhinoplasty video blog is about rib cartilage and its use in rhinoplasty. Many patients come seeking rhinoplasty, and in a certain selection of patients, they need rib cartilage in order to get a good result. This, of course, makes people scratch their heads why they need to get rib cartilage harvested in order to get a good result. One of the first questions is, where will this rib come from? I show patients a diagram like this. The rib that I typically use is either rib number 5 or rib number 6. The incision is placed right under the crease of the breast in the female patient and right over the most prominent part of the cartilage of rib 5 or 6 in the male patient. The incision generally is 1 inch and 1.5 inches long and will heal in a position so it will be able to be hidden by a bra or a bikini top. The scar will be very thin and will be very inconspicuous over time. In some patients, it's obvious that rib cartilage is necessary. In these individuals, they have very significant defects of the nose, either from trauma or from previous surgery, and a very large, bulky piece of cartilage is necessary to fix it. In this gentleman who suffered a motor vehicle accident, he had a previous rib graft placed too high in the nose that wasn't large enough for the full correction. I harvested rib cartilage, allowing for a more complete correction of the profile of his nose, the base of his nose, and the front of his nose. Other patients are concerned about the possibility that there may be complications with rib grafts. One of the most common complications is warping. Although this is reported in the literature, carving the rib graft from the center of the piece of rib can prevent warping. This is something that I've shown in a study that I performed while at the university. The rib is almost like a piece of wood. If you carve a piece of wood from the periphery near the bark, the forces of contracture cause that piece of rib to warp. But if you carve it from the center of the rib, the concentric forces of contracture allow it to stay straight. In some cases, I'll carve the rib piece so that I'll have 2 pieces from the edge and a piece from the center. The pieces from the edge will warp in an opposite curvature, and I may use these pieces of curved rib for my purposes and to my advantage. For example, along the side walls, I may want a piece of curved cartilage to form a nice curved outward contour to the nose. In other cases, I may use 2 pieces of rib cartilage that are warped in the opposite direction and suture them together to overall create a straight piece. That's a technique that I used in this patient who had a severe trauma. I used 2 centrally placed pieces of rib cartilage in the central portion of her nose. Their curvature cancel each other out, creating an overall straight profile. And you can see this also led to a significant improvement on her side view. Overall, rib cartilage is a very safe and effective tool used in rhinoplasty. We don't use it in every case, only when we need it. The other examples which I didn't mention are in revision rhinoplasty, where septal cartilage may no longer be available because of previous surgery. Ear cartilage may not be suitable because of its curved and floppy nature, and rib cartilage serves the best function for those types of situations. Asian patients who have very flat noses when they need a significant amount of bulk, those are also patients in whom rib cartilage is very favorable. So in summary, rib cartilage is a very safe and effective tool. It's something that patients do have fear about when they don't know about it, but after adequate explanation, most patients find peace with knowing that rib cartilage has helped many of my patients with very few complications.